So friends, I welcome you back to my YouTube channel. I am Professor Govind Narayan Purohit, the Head Department of Veterinary Gynecology and Obstetrics, College of Veterinary and Animal Science, Rajasthan University of Veterinary and Animal Sciences, Bikaner, Rajasthan, India. In a series of lectures, I had been deliberating and discussing on the various topics of veterinary gynecology and obstetrics. And in our today's topic, we discuss something about the causes of dystocia in farm and pet animals. Now, before discussing about the causes of dystocia, first let us discuss what is dystocia. Dystocia is the difficult birth, and the term used to describe a safe, physiological and normal parturition or delivery is eutokia. Now, a lot of disorders can occur during parturition, and dystocia is one of them. The other disorders could be a prolonged gestation, rupture of the birth canal, and today we are only discussing about the causes of dystocia. Now, the causes of dystocia have been classically uh, divided into two causes, the one because of the mother, the maternal cause, and the one because of the fetus, the fetal causes. Fetal cause. The maternal causes could be because of problems with the expulsive forces and because of the problems in the birth canal itself. There can be a lack of expulsive forces because of lack of uterine expulsive forces, which is known as the uterine inertia, and the uterine inertia has been classified into the primary and the secondary. The primary can be partial or total. Then because of the rupture of the uterus, there could be lack of the expulsive forces, and then because of the uterine torsion, there can be lack of the expulsive forces. Then the abdominal expulsive forces could be poor because of age, debility, painful conditions, uterine hernia, rupture of the diaphragm, and these can lead to problems in the expulsive forces. Then there can be problems with the birth canal. Say the two distinct causes could be inadequate pelvis and insufficient dilation of the birth canal. The pelvis can be inadequate because of immaturity of heifers, the pelvic fracture, exocytosis, breeding of small breeds with larger breeds, and developmental diseases. Then insufficient dilation could be because of uterine torsion and cervical dilation failure, vaginal strictures, tumors, etc., improper vulvar dilation, or vulvar stenosis. These are the maternal causes. Now, the fetal causes that can result into a difficult birth could be the fetal oversize, the absolute, such as monsters, or relative. The fetus is larger in comparison to the maternal birth canal. Then fetal deaths and emphysema can result into fetal oversize, and then fetal defects such as ascites, anasarca, hydrocephalus. They can increase the size of the fetus and cause a difficulty in the delivery of the fetus. Then the fetal maldisposition, improper placement of the fetus in the birth canal can result into a difficult birth. Now, before discussing in more details about the different causes, let us discuss some terms which are used in the obstetrics. And these terms are basically used to explain the position of the fetus in the birth canal. The presentation, the first definition is presentation, is the relationship of the long axis of the fetus in relation to the birth canal. And this could be longitudinal, transverse, or horizontal. Longitudinal then could further be divided into the anterior and the posterior. The anterior is currently known as the cranial, and recent classifications, they say that the posterior, it would be more appropriate to use the word caudal so that you can understand easily. Then position is the relationship of the dorsum of the fetus as applied to the quadrants of the mother, and the quadrants of the mother are sacrum on the top, the ileum on both the sides, and the pubis underneath. So the position can be dorsosacral. If the dorsum of the fetus is towards the sacrum of the mother, it could be dorsoileal. If the dorsum of the fetus is towards the ileum of the mother, and dorsopubic if the dorsum of the fetus is towards the pubis of the mother. Then posture is the relationship of the head and extremities of the fetus to its own body, and the different postures we will discuss later on, say flexion of the limbs or the deviation of the head, and these we will discuss further. So here in this picture you can see the normal birth posture is anterior longitudinal presentation, dorsosacral position, both forelimbs extended and the head of the fetus extended and resting on the knees. You can see the different, in these three pictures you can see the normal fetal delivery position in a mare, and then in a sheep, and in a bovine fetus. Then there had been classifications which depict that the causes of dystocia can be basic or immediate, and they say the basic causes could be hereditary, say breeds like brown Swiss or bulldogs, in then defects like hydrocephalus, achondroplasia, pyrosomas, and then nutrition and management, small size of the dam, disproportionate mating, poor or excess feeding, and then traumatic, ventral hernia, rupture of the prepubic tendon, and miscellaneous, which includes the calcium deficiency, which may cause lack of the uterine contractions. Then what we had already discussed, the immediate causes, which could be maternal and fetal or a combination of both. The maternal causes we had classified previously, and now we discuss in detail about the different maternal causes: failure of the expulsive forces or the insufficient dilation of the birth canal. The expulsive forces, first we discuss about the uterine expulsive forces. The important failure of the uterine expulsive forces is known as uterine inertia. Uterine inertia has been classified into the primary and the secondary type. The primary uterine inertia is due to myometrial defects, overstretching, degeneration, uterine infection, small litter size, or heredity. Biochemical deficiencies like those of estrogen, oxytocin, prostaglandins, relaxin, calcium, and glucose can result into lack of the expulsive forces. Then environmental disturbance, nervousness, oligoamnion, premature birth, lack of exercise, all these can contribute to uterine inertia. Uterine inertia is considered secondary if it is due to exhaustion. Say if a fetus is in the birth canal and it is trying to, the mother is trying to expel it out, but because of some abnormality in the fetal posture. It could not be delivered, and mother had been trying and trying and trying, and ultimately the mother is exhausted, and the uterine expulsive forces become weaker, and so this is considered to be a secondary uterine inertia. The Dachshund, Labrador, Retriever, German Shepherd, Great Dane, Saint Bernard, Pug, Pomeranian, these breeds of dogs are more prone to complete primary uterine inertia in the bitch. The nervous voluntary inhibition of labor can occur in the bitch, and in the bitch, the primary uterine inertia has been classified into primary partial and primary total. So, primary partial if one or two of the pups have been delivered, but then no more pups are delivered, and primary total if no pup is being delivered. Then the therapy suggested for uterine inertia is calcium borogluconate intravenous in cows. In bitches, calcium gluconate is suggested, uh, 5 to 10 ml, but one should monitor the heartbeats before administration of calcium to a bitch. Since bitches they have hypoglycemia, with uterine inertia they have hypoglycemia, so administration of dextrose is also suggested. Uterine motility stimulants like oxytocin is suggested for the bitch, and if you have administered one dose of oxytocin and say two pups have been delivered, but two more pups are there and they are not being delivered. So if you intend to administer a second dose of oxytocin, it is suggested to administer spasmolytic, because administration of oxytocin can result into segmental spasm in the uterine musculature, and so concurrent administration of a spasmolytic is suggested. If all these attempts fail, finally in the bitch, a administration of prostaglandin is suggested, and if that also fails, a cesarean section is suggested. Uterine rupture, it can be spontaneous due to a weak point, and then it can be induced because or accidental because of rolling during torsion correction in cattle. In large uterine ruptures with severe internal hemorrhage, death usually occurs in a short time period. In smaller ruptures, animals may show transient colic without fetal delivery. Sometimes intestines may prolapse from the vulva coming out through the ruptured part of the uterus, and these cases are having grave prognosis. The administration of oxytocin after fetal delivery would contract the ruptured part of the uterus. However, extensive ruptures with prolapse of abdominal organs necessitate emergency laparotomy with repair of the uterus. In the goats, sometimes uterine ruptures with prolapse of the intestines. If the rupture is just nearer to the cervical part, it becomes difficult to repair it even after a flank laparotomy. Then uterine torsion we will be discussing in a later lecture. The abdominal failure of the abdominal expulsive forces could be because of age, pain, and debility, diaphragmatic hernia, abdominal hernia, and manual assistance would be required in all such cases to deliver the fetus. Then insufficient dilation of the birth canal. There are it has been classified into two types: the inadequate pelvis due to pelvic fracture, exocytosis, immaturity, breed, predisposition, neoplasia, and it's really difficult to deliver a calf from a mother which has a inadequate pelvis, and is emergency cesarean section is suggested. Then insufficient dilation of the birth canal due to uterine torsion, herniation, adhesions. Clinicians are confused for insufficient dilation of the birth canal sometimes when an animal is in fact having a uterine torsion. And so the first thing one should look in should be the presence or absence of a uterine torsion. If there is a uterine torsion, then that must be corrected first, and then something else should be looked for. Then cervical dilation failure, congenital defects, fibrosis of the cervix, then with the insufficient dilation because of problems in the vagina. Could be because of congenital defects, fibrosis, prolapse, perivaginal fat deposition, strictures, and then those of the vulva could be congenital defects, fibrosis, and immaturity of the heifers. Cervical dilation failure at parturition is a common problem with the sheep and goat, and less prevalent in the buffalo. Cervical dilation at parturition involves a complex process. It is a multifactorial process which is an outcome of hormonal regulation, inflammatory processes, and enzymatic breakdown of collagen. When fully dilated, the cervix is continuous with the vagina, and one can easily make it out if the cervix is fully dilated or not. Cervical dilation problems are less common in the buffalo compared to cattle due to more capacious pelvis, a larger area of the ilium, and free and easily separable fifth sacral vertebra. Cervical dilation problems are common in sheep and goats, and this is known as the ringworm. When cervix is not dilated sufficiently, it is palpable by transrectal palpation, and on vaginal examination, a slit in the cervix permitting only the passage of one or two fingers is found. The animal should be examined to rule out uterine torsion first. Sometimes it is beneficial to wait for some time and then evaluate again. For cervical dilation problems, beta-2 adrenergics such as salbutamol, terbutaline, isoxaprine, hydrochloride 50 to 100 mg IM or IV for cows, and 100 to 150 mg for mares, and 10 to 40 mg for sheep and goats can be tried along with manual manipulation, but results are inconsistent, especially with cattle. Many a times all these approaches they fail. Then clenbuterol can be given 0.3 mg IV or IM. In Germany, a product is available, denavarine hydrochloride, which is given 400 mg intramuscular, but it is not suggested if parts of the fetus are not in the cervical canal, and hence such an approach has limited value. Valethamate bromide injection epidocin, an antispasmodic, has been shown to shorten the first stage of labor at dose of 80 mg intramuscular in cattle and 24 to 40 mg in sheep and goats, and also in cervical dilation failure due to cervical spasm in cattle. But the results are inconsistent because it's not always because of the cervical spasm. It is basically because of the poor loosening mechanisms. Drugs such as misoprostol local application have shown some promise in mares but not in cattle, and similar results were obtained by intramuscular administration of retrodrine in cattle. In the presence of an emphysematous fetus, partial cervicotomy has been suggested if the fetus is in the birth canal. Caesarean section is suggested if drug therapy fails. Then improper vaginal dilation could be because of congenital structures in the vagina or fibrous tissue bands, which often hinder conception in bitches but seldom impede whelping. Abscess in vagina can rarely cause dystocia but can be easily drained prepartum if located. Sometimes during the fetal delivery, the abscess may rupture spontaneously and some pus may come out along with the fetus. Vaginal tumors or growths of small seldom cause difficulty in parturition, yet large growths may sometimes cause problem in the delivery. Often many growths protrude outwardly postpartum and can be removed surgically by general or cryosurgery. In the presence of vaginal hematomas, large immature abscess, it is often safe to opt a cesarean section because vaginal hematomas may be problematic. Then vaginal cystocele could be a reason for improper dilation or improper uh, condition of the vagina. Vaginal cystocele is the prolapse of bladder through urethra or vaginal rupture. The bladder must be replaced first after pushing the legs of the fetus back in the birth canal. Then vulvar stenosis, fetus can be delivered by traction with or without a episiotomy cut about one third down the commissure of the vulva through the skin mucosa junction. This is a case of vaginal cystocele. The bladder has prolapsed from the urethra, and one has to replace the bladder first and then take out the fetus. Now we discuss about the fetal causes of dystocia. Fetal death uh, lack of would result in lack of initiation of the birth process, lack of movements. Fetal oversize could be absolute or relative. A large size fetus, such as a monster or a disproportionate mating, can result into fetal dystocia. Then it could be relative, a fetus larger relative to the pelvis. Fetopelvic disproportion is common in heifers that calve at less than 2 years of age. Fetal defects such as ascites, anasarca, and hydrocephalus. These increase the overall diameter of the fetus and thus result in dystocia. Then fetal maldisposition could include the malpresentation, the malposition, and malposture. Malpresentations could be transverse, lateral, and vertical, and malposition could be dorsopubic, dorsoileal, and oblique. And malpostures in the anterior presentation include the limb flexion at carpal, elbow, or shoulder joints, and head deviation, which could be lateral, upward, and downward. The downward deviation of the head is further described as vertex, nape, and breasthead. In the posterior presentation, there could be a Hock flexion or hip flexion, and bilateral hip flexion is known as the breech. Fetal defects such as ascites, hydrocephalus, and anasarca. Now, first I try to explain the abnormal presentations. The first is the transverse presentation. The fetus is placed transversely in the birth canal, and so it cannot be delivered. It is common in mares. However, in mares also the incidence is too low, 1 in 10,000 foalings. The in the dorsotransverse, the dorsum of the fetus is towards the birth canal, and in the ventrotransverse, the fetal legs, all the 4 fetal legs are in the birth canal. You can see in these pictures the dorsotransverse and the ventrotransverse type of abnormal presentations of the fetus that can result into difficult births. Usually, with transverse pregnancies in mares or transverse deliveries, presence of fetus in transverse presentation, is an emergency cesarean section is suggested. Then a dog sitting posture, which is considered a ventrovertical posture, in which all the 4 legs along with the head of the fetus are in the birth canal and appear at the vulvar lips. Then simultaneous presentation can occur in sheep and goat, wherein the 2 fetuses come together to be delivered at the birth canal, and then They are blocked because both the fetuses cannot be delivered simultaneously. Then abnormal positions, the dorsopubic and dorsoileal positions are the abnormal position. In the first picture, you can see the dorsum of the fetus is towards the pubis of the mother, and this is one of the most difficult type of dystocia, uh, in which an emergency cesarean section is often suggested. And in the second picture, you can see the dorsoileal type of uh, position. In fact, the equine fetus, it rotates round from a dorsoileal to a dorsosacral position just immediately before its delivery. But if it does not rotate, then there will be a difficult birth. Then abnormal birth postures, head deviation and limb flexion. The limb flexion can be occurring at the carpal, elbow and shoulder. In the anterior longitudinal presentation, the lateral head deviation can occur, and in the picture shown above, you can see the lateral head deviation, and then downward head deviations are known as the vertex, nape, and breast head, based on the position of the fetal head. Then carpal, elbow or shoulder flexion can occur with the limbs. This is, in these pictures, the lateral head deviation of the fetus is shown. It is very common in cattle. Uh, the limb flexion and the lateral head deviation is the commonest cause of difficult births in cattle and in mares also. Then downward head deviations. This is the in the first picture. You can see it's the vertex when the nose of the fetus it just touches is just below the pelvic canal, and then it is nape if the pole of the fetus is touching the pelvis of the mother, and breast head if the uh, head and neck of the fetus completely deviates downwardly so that the head touches the breast of the fetus, and this is known as the breast head. Then you can see the difference in the head deviation in a calf and a foal, because the head of the foal is larger as compared to the length of the head is larger in the foal as compared to the head length in a calf. So these are the limb flexions, the carpal flexion, the one of the maybe unilateral or maybe bilateral, maybe one limb is flexed or maybe both the limbs are flexed at the carpal joint. Then elbow flexion, again this can be unilateral or bilateral. One of the limb in the picture shown here is flexed at the elbow. Then shoulder flexion, if the maybe either unilateral or bilateral, and the calf with shoulder flexion has first to be converted into a elbow flexion and then a carpal flexion, and then it has to be corrected. In posterior presentations, there could be a Hock flexion or a hip flexion. A bilateral hip flexion is known as the breech birth. In these pictures, you can see in the first one there is bilateral hip flexion, and in the second one there is the Hock flexion. Again, in these pictures, it's more clearly shown the hip flexion in a mare fetus and bilateral Hock flexion. If there is a bilateral hip flexion, it has to be converted to a Hock flexion first, and then the hoof of the fetus have to be caught, and then it has to be straightened. Both the it should be corrected on both the sides if it is bilateral. So this is a table showing the most frequent cause of dystocia in cattle and buffaloes. We had an analysis at our referral centers, and they showed that fetopelvic disproportion was one of the biggest cause of difficult birth, and fetal malpresentation accounted for an equal number of dystocia both in cattle and buffalo. But in buffalo, the highest incidence was for uterine torsion. Now, the incidence of dystocia in the mare is rare. The most frequent cause of dystocia in mares is lateral head deviation, followed by posterior presentation problems and rarely transverse presentation. The common causes of dystocia in sheep and goat are fetal maldispositions and birth canal obstruction. Ringworm or the cervical dilation failure is one of the most common cause of birth canal obstruction and thus dystocia in sheep and goat. The most common cause of dystocia in the bitch, cat and sow is uterine inertia followed by fetopelvic disproportion. The most common cause of dystocia in camels is the uh, fetal, fetal malpresentation, especially the deviation of the head and neck, which is very long and it's very difficult to correct. So, thank you very much. Kindly share the video and subscribe to my YouTube channel Govind Narayan Purohit if you like them. Thank you. Thank you very much.